Does your heart unexpectedly start to race or pound, or feel like it keeps skipping beats? These sensations are called heart palpitations. For most people, heart palpitations are a once-in-a-blue-moon occurrence. Others have dozens of these heart flutters a day. Different people experience heart palpitation symptoms in different ways. Palpitations can feel like the heart is fluttering or pounding. They can also feel like the heart skips a beat. Some people feel palpitations as a pounding in the chest or neck. Others feel them as a general sense of unease. Although heart palpitations can be worrisome, they're usually harmless. Rarely, heart palpitations can be a symptom of a more serious heart condition, such as an irregular heartbeat, arrhythmia, that might require treatment. What causes heart flutters? Normally, the pumping action of your heartbeat, is controlled by your heart's electrical system. In a healthy heart, regular electrical signals cause the heart to contract and relax in a steady rhythm of 60 to 100 beats per minute. Palpitations can appear out of the blue and disappear just as suddenly. They can be linked with certain activities, events, or emotions. Some people notice their heart skipping a beat when they are drifting off to sleep. Others, when they stand up after bending over. Palpitations can be triggered by stress, anxiety, or panic, dehydration, low potassium or low magnesium, low blood sugar, too much caffeine, or alcohol, fever. Some palpitations stem from premature contractions of the heart's upper chambers, atria. When the atria contract a fraction of a second earlier than they should, they rest an instant longer afterward to get back to their usual rhythm. This feels like a skipped beat and is often followed by a noticeably forceful contraction as the lower chambers, ventricles, clear out the extra blood they accumulated during the pause. These premature beats are almost always unharmful, meaning they aren't life-threatening or the sign of a heart attack in the making. Two other heart rhythm disturbances that can cause palpitations from above are atrial fibrillation and supraventricular tachycardia. Atrial fibrillation is an irregular and often rapid heartbeat caused by chaotic electrical activity in the heart's upper chambers. Supraventricular tachycardia is a faster than normal heart rate. Tachycardia means fast heart rate that begins above the heart's lower chambers. Both of these may cause palpitations that may be brief or prolonged. Treatment for heart palpitations. Treatment for heart palpitations depends on the cause. They often do not need to be treated. Avoiding things that can trigger palpitations, such as stress, smoking, caffeine and alcohol, can help. You may have an electrocardiogram, ECG, to help find out what the cause might be. This is a test where small pads are stuck to your skin to check the electrical signals coming from your heart. If your palpitations are caused by a heart problem, you may need medicines or a procedure to help correct your heartbeat. You can manage an abnormal heart rhythm by identifying your triggers, taking medicines as prescribed, making healthy lifestyle changes, managing blood pressure and cholesterol levels and maintaining a healthy body weight. When to see a doctor. Palpitations that are infrequent and last only a few seconds usually don't need to be evaluated. If you have a history of heart disease and have palpitations that occur frequently or worsen, talk to your healthcare provider. You may need heart monitoring tests to see if the palpitations are caused by a more serious heart problem. Seek emergency medical attention if heart palpitations occur with chest discomfort or pain, fainting, severe shortness of breath, severe dizziness. While palpitations can be bothersome, they're usually not a sign of anything serious. There are ways to prevent palpitations, such as avoiding known triggers like stress, alcohol, and caffeine. Also, remember that everyone is different, and your triggers may not be the same as another person who has heart palpitations. If your heart palpitations seem to happen after drinking coffee or after certain types of exercise, then try to avoid these triggers. Thanks for watching. Don't forget to like and subscribe.